According to current circumstances in 3 mountainous provinces of the north of Thailand, these remote areas lack modern transportation and are not easily accessible. The provinces are defined by overlapping mountains in border territories. Opium growth is rampant. Due to cultural differences and the belief in opium as medical treatment, there is a large number of opium users. These users usually have deteriorating health, face family problems, and commit various crimes causing many social problems for the country. The way of life of ethnic people living in these mountainous areas are limited in opportunities. They are poor, lack education, and have no rights to public health services. Healthcare is very expensive, be it medical fees, transportation costs, and the time taken to access health facilities. Opium addicts are deterred from putting themselves into the rehabilitation system. Attempts to solve the opium problems in the past has not been successful, not until PM NIDAC's integrated coordination with local teams and all units in the area to collectively rehabilitate opium users on the mountains of the 3 provinces in the north, including 7 districts. During the immediate rehabilitation period, there were many problems. It was difficult to locate opium addicts due to the mountainous terrain. Another approach was used, which involved both the public and private sectors. The mission started by targeting smaller areas with community leaders who were ready to see positive changes to the lives of addicts. The first drop-in center was established at Ban Santi Wana of Chai Prakan district. Opium addicts would come to this center for consultations and to collect their methadone treatment conveniently. It was considered as a proactive service previously not available or made accessible to those in mountainous areas. Using methadone, categorized as a narcotic drug too, as a cure is considered as a challenge, being difficult to organize and supervise usage. The strict regulations which governed the use of the drug had to be relaxed in order for methadone to be used in the community. Family members also played an important role in accessing public health services equally, including in monitoring the safety of methadone intake. Law amendment and controlled distribution governing the use of methadone was made possible from the joint push by all agencies involved. The members of the affected community played an especially significant role as they wanted to see the lives of their ethnic peers improve to be free of opium addiction. Therefore, many community members volunteered in this important drive.
ได้มีการมีส่วนร่วมกับโครงการนี้ก็ได้มีการเรียกประชุมคณะกรรมการของอำเภอและมีการตั้งคณะกรรมการ Harm Reduction ระดับอำเภอและหมู่บ้านขึ้นนะครับซึ่งคอยสนับสนุนและให้ความช่วยเหลือในด้านการปราบปรามการบำบัดรักษาติดตามช่วยเหลือบำบัดผู้ติดฟิตตลอดจนส่งเสริมการพัฒนาอาชีพให้มีรายได้ที่มั่นคง
The implementation focused on the development of rehabilitation in the community through education. Workers at the drop-in center were trained to have proficiency, adjusted their attitudes, and constructed coordination networks among the communities for smooth collaboration, offering sustainable services. Services took an integrated, holistic approach, which included psychiatric care, the work of communicable diseases specialist, mother and child, social welfare, and career development experts. Patients and the general public all had access to the general public healthcare services. The services offered at the drop-in center covered all diseases and welcomed patients of all ages. A trust among patients was developed to the point that patients would spread the word about the facility to other patients. The number of addicts seeking help rose to 2,288. The number of centers increased from the original one at Santi Wana to 7 more being established in 7 districts. Currently, there are 25 such centers altogether in the country. Treatment offered as part of this campaign made it possible for opium addicts to receive help, enjoy improved health, and be accepted by their community. They are now able to make a living by working, earning a sustainable income. Domestic violence rates decreased. As an end result, everyone in the community are now self-sufficient and independent.